Okay, so let's look at the technique that we're going to do for Achilles tendon. As I said before, the soleus can mimic Achilles tendon pain beautifully, okay, but keep in mind when we're working with the gastro and the soleus, we need to be focusing on both of those. So we have a couple of trigger points up high, both in the lateral and in the medial compartments here as well. So we can focus on those. Okay, so what I like to do, obviously once again, we're going to use the fingers with a hand over the top braced and work across the actual muscle itself. Okay, so it's really important that we're dedicating as much pressure within what our clients can handle across the lateral head, okay? Then we can come across the medial head as well, okay? Now, some of the things that I like to do is get the broad forearm involved. So I will just turn the leg slightly in, and then I can pick up with a really broad forearm. Okay, so now I can sink down into that area and work really purposeful and slow. Okay, so this is the side, I suppose this is the speed that we like to work at with this particular type of technique. Okay, so if you're rushing through here, then you're really not doing your due diligence and picking up a lot of this tone, okay, and deloading. So we're going to work it all the way up. Okay, and then we blend off, and again sinking in, going to drag the tissue over, lock down on it, and then work through. Okay, now what we also can do is we can stop for each one of those trigger points too and just sit on those, just looking at watching them deactivate, then moving on to the next one and working through. Okay, so don't rush this technique, okay? It's really important that it's purposeful, because a lot of therapists just love to just smash, work through really fast in this tissue, and trust me, that's not the result you're going to get, okay? So you take the exact same approach to working the medial compartment as well. Okay, so we come down to the soleus, which is our middle distance muscle, as we all know. So that's the workhorse. That one takes a lot of the load. This is our explosive sprinting muscle, gastro, so it's important that we dedicate significant amount of time once again to this soleus. So as I said before, what we can do, address lateral and medial. Keep in mind that we have that trigger point in the medial, which mimics Achilles tendon pain just beautifully. Okay, so it's the same approach again, but now what you're doing is you're applying it to your soleus muscle. Okay, or soleus, depending on how you pronounce it. Okay, so once again, locking down, purposeful pressure. Do not try and rush through it. Okay, so it's all about working purposeful. Okay, really important. Now, do not get sucked into working on the Achilles itself, the tendon itself, because more than likely what you tend to do is aggravate it. Okay, so a lot of these techniques are dedicated just to offloading that tendon through there. Okay, once again, you need to explore this trigger point in the medial head. Okay, because basically it refers right into the tendon and sometimes down into the heel. Sometimes your tib post can also refer down into the Achilles as well. So they are two trigger points that you can dedicate time to see if they could possibly be a mimicker.